Hi everyone, I'm Sharifa from Cornell University. Today I will present our paper Dissemination, Situated Fact-Checking and Social Effects of Misinformation Among Rural Bangladeshi Villagers During the COVID-19 Pandemic. This work was done with Susan Fussell. The COVID-19 pandemic is a global challenge due to inconsistent findings from the available studies on the virus, medical experts' limited experience with the disease, and limited availability of effective treatments and vaccines. People in low-resource marginalized communities in the global south were also struggling and looking out for remedies and cures. For example, the first image shows the cow urine party organized in India, the second image shows shamanic spells on household staff, and the third image shows a seller selling amulets with religious scripts in Bangladesh. All of them claim to cure COVID-19. Thus, people in the global south were exposed to healthcare misconception, but they had limited access to tools and technologies that combated misinformation, mistrust in formal healthcare providers and methods, and the technologies that explain healthcare misconception using facts regarding processes and diagnosis were useless to them. And many preferred spirituality and situated knowledge over modern scientific rationality to address well-being concerns. To help such marginalized communities combat misinformation hazards, we need to understand how fact-checking of misinformation works in the communities that use spirituality, situated knowledge, and faith-based system for well-being, which is a gap in the literature at this moment. Our work addresses this gap in the literature by investigating how do rural Bangladeshis gain their understanding of the pandemic while they have limited access to information and communication technologies, how do different type of pandemic related information influence rural Bangladeshis' lives, well-being and healthcare in the neighborhood, and which cultural factors influence rural Bangladeshis situated fact-checking processes, and what is specific about rural Bangladeshi situated fact-checking processes. We conducted a 6-month-long ethnographic study in 3 villages in Jashore in Bangladesh. The image on the right shows that it is in the remote corner in southwest of the country. We engaged with 90 people through observation, interviews, and focus group discussions. We found that villagers often shared and discussed medical and healthcare related suspicious information, religious, para-religious, and faith-based rumor because they aligned with local norm and values, socio-political rumors, and local economy. All of this contributed to villagers growing mistrust in formal healthcare and more trust in informal healthcare and faith-based well-being practices, and also led to an endangerment of social solidarity and turmoil in local market. To combat confusing and misleading information, villagers relied on their cultural norms and moral value systems. Now let's have a look how rural population in Bangladesh used situated fact-checking processes to combat misinformation. Whenever the villagers came across any confusing information, they would turn to social experts whom they considered somewhere upper stage in hierarchy of fact-checking processes. For example, within the family, the experts were the elders, men, members who lived away in another village or town, and those with formal education. Also, local school teachers, NGO health workers, rural leaders, leaders of the mosque, and priests of temples were considered experts. We found that these experts also warned the villagers about latest misconceptions. The villagers would conduct the discussion with the experts in their regular social gathering. They consider both scientific and local value-based perspectives while analyzing the information in question before deciding how that information would be relevant to their situation. To explain this better, one of our participants who was a tea stall owner gave us an example where a man in his village was tested COVID positive and the villagers often discussed the patient's status in his stall. He said the family made a temporary poor hut and gave him food from afar. A few students said this was logical because the doctor on the internet had suggested to keep the patients away from healthy people. But it was midsummer at 100°F. He was unprotected. Even stray dogs went to his hut a few times. Villagers discussed this in the mosque during Jummah, the Friday noon prayer, and agreed that sick people should be treated with care as Islam instructs. Later, the mosque community arranged a bed in the hospital for him. Also, while considering someone as an authentic source, villagers considered social reputation, personality, practicing value of the person whose words are in question. One of the female participants explained to us, "If it is my next door neighbor, then I trust her as she is very religious and gentle, so she would not make something up. However, things might get twisted if she heard it from my sister in law as she is chaotic." We also found that villagers often looked up if the suspicious information had any connection to religion and spirituality, local myth and para-religious practices, and their perceived medical knowledge. For example, many villagers thought that the virus would infect the unethical people, but some other people may also suffer as a part of collateral damage. So, one of the participants gave us an example of how this perspective connected to an ancient local myth of epidemic. He said, "Back in my grandma's time, Ola Bibi, the deity of cholera, punished the cruel zamindar, who is like local landlord appointed by British colonizers, when she entered the castle. Not all are getting infected, only the sinners." See, a breaking news was at that time being broadcast on TV that said an assistant minister was sick. "They are thieves. They stole people's money and property. As nobody could touch them, so Corona Bibi did." The rural experts also analyzed how the information in question connected to local situated knowledge and indigenous practices and its influence to rural morality and social justice. For example, during a discussion on the recent plummet in local tilapia market, some participants were upset that farmers faced a huge monetary loss. However, other participants claimed that those fish in the farm were fed with medical wastes collected from the hospitals and already the farmers saved a lot. Furthermore, this second subset of participants explained that a rumor that police would arrest people if they found tilapia in their freezer was legitimate. One of them explained, "If the tilapia fish ate human wastes from the hospitals, they may also carry the virus, right? Moreover, feeding people the fish that ate human waste is unethical. I think it's okay that people believed the rumor and refused that fish." Our study has several takeaways. First, we present some implications to design. We found that social media provided fact checking being less useful to the villagers. To address this, we can design a platform that would hold a database of suspicious information and verify them under supervision of concerned local NGOs, community health workers, and local government. We can also introduce forced push notification for suspicious information in a way that once they are verified, the result should itself reach out to the users who came across it. Our study has some broader implications too. We found that rural situated fact checking valued the credibility and authenticity of information along with its legitimacy and impact on moral and criminal justice. Such sensibilities should be integrated while designing to combat misinformation. While many modern fact checking tools aim at finding objective truth, we point out that a mythographic approach might help better here. We also argue that designing to combat misinformation should be democratic and include policymakers, technology companies, local government, and concerned NGOs, along with the users from low resource marginalized communities. We thank Rural Reconstruction Foundation for helping us during the fieldwork and Facebook Fellowship for funding this work. We thank everyone for attending this talk too. Now we will welcome questions.